And welcome back. I'm Mabel, Jong, and you're watching continuing coverage of the World Healthcare Congress here in Washington, D.C. I'm so pleased to have with me now Paul Kusserow, who's president and CEO of Amedisys Home Health.
Yes.
And we're going to focus on the topic of home health care and why this is a growing area. Welcome.
Thank you very much, Mabel. I appreciate it.
So in terms of home health care, are you finding that people are wanting to find solutions and strategies to stay in their homes as they age?
Yes. We're seeing it's almost like a revolution out there, particularly with the baby boomers. What we're seeing is people believing that it's their right to stay at home and their desire to stay at home. And there's increasing technologies, there's increasing care that enables people to stay at home all the way up to the time they die. And people prefer that. We find that when people stay at home, they have the psychology of things is better. It's a lot less expensive as well, so it saves tremendous amounts to the healthcare system. And we believe increasingly we can take care of sicker and sicker people in their homes.
Okay. What is your company focused on providing? You have staff that not just more like assistants or people in the home that can help achieve some of the work that's in the home?
Sure. Well, we have three businesses. So our largest one is home health. That's where when someone leaves the hospital or it's determined that they can't stay at home independently, our job is to get them back to the place where they can stay at home independently. So we work in a skilled way. We take care of them so that health-wise they can start to stay at home independently. And we also are one of the largest players in hospice, and we do that in the home as well. So this enables people to die in their home. And then we're also in the personal care business. This is an area we just started getting into in the last 2 or 3 years, which actually is unskilled care. We're finding that some of the things like getting food, bathing on a regular basis, making sure your environment is healthy and safe is something that's increasingly important as well. So we're expanding that area of business. But overall, as a company, we have about 18,000 employees. We're in 35 states. Most of our employees are clinicians, and 45,000 times a day we go into people's homes and take care of them.
Okay. Is it less expensive to stay in your home versus moving to a facility like an assisted care living facility?
It's about a half to a third of the cost. So, and it's obviously what's preferred. If there's a variety of studies that are out there, but 90 to 100% of all the people would prefer to stay at their home versus go into an institution. Mm-hmm. And so there are a variety of types of institutions. There's skilled nursing facilities, there's assisted living, there's hospitals, there's rehab facilities. But in general, most people, if possible, would really like to stay in their homes.
Mm-hmm. You have a number of partnerships, too.
Yes.
Can you talk a little bit about the health systems that you partner with, too?
We have what we believe is that that it's a continuum of care. So when somebody discharges, and these are hospitals that we're partnered with, when somebody discharges from the hospital, it's very important that because they discharge people quite early now, they're still quite sick in a lot of cases. So it's very important that we coordinate this care. And when someone leaves the hospital, that within 24 hours we're in their home, making sure everything's right, assessing their situation, building a care plan for them so they don't go back in the hospital. One of the key things why hospitals do these sorts of things is they don't want readmissions. They don't want someone to go back, not get taken care of, get sicker and sicker, and then come back to the hospital and have to be taken care of all over again in the hospital. The hospitals are penalized for that. Mm-hmm. So that's what we work to make sure that no one has to go back into the hospital unless it's really necessary.
What about reimbursement? Are potential patients using your programs able to get this covered?
Oh, yes. It's Medicare. So as long as their doctor or the hospital prescribes this for them, home health is a Medicare-covered benefit. It's also covered by insurance plans for Medicare Advantage. So the insurance plans do it very similarly to how the government does. So anybody, and that's largely our population, largely anybody on Medicare has the right, assuming that the doctor prescribes it, to have home health.
That's very interesting.
Yeah.
Other programs in the pipeline that you want to share with us today?
Sure. We're actually looking on starting to take risk. in the home. And what that means is we want to basically be able to say that we can hold somebody in place, hold somebody in their home in a good way, take really good care of them, do it on a consistent basis so they never have to go into an institution or back into a hospital. And so we're starting those programs right now with a number of payers. We're hoping the government will start to do it. The government's been much slower, though, unfortunately. But some of the payers like United and Humana and Anthem have been actually more in the forefront, so we're starting to work with them. We think eventually the government will come along, and because it's so much cheaper to stay at home.
All right. Paul Kusserow, thank you so much for your time today. Very interesting.
Thank you, Mabel.
Thank you.
Appreciate it.
Good
Take
to
care.
meet you.
Okay, thanks.
And I'm Mabel Jong. Thanks for watching. Stay tuned.